This is Sherry Boschert reporting for Global Medical News Network.
No guidelines exist for prevention of venous thromboembolism in long-term care settings. Dr. Dharmarajan and his associates modified existing guidelines that were developed for hospitals and distributed these to 17 long-term care centers in 9 U.S. states.
This is a study intended to look at current physician practices in long-term care. While prevention of venous thromboembolism is a well-recognized mode of practice in hospitals at this time, its use in the practice of residents in long-term care is less clear. Patients in long-term care are different in that their comorbidity, life expectancy, quality of life, and caregiver wishes are quite different from that of the hospital setting.
They studied 376 patients admitted to these nursing homes before this educational intervention and 362 patients who were admitted after receipt of the guidelines to see how many were assessed for prevention of venous thromboembolism.
The response and the results were dramatic. We showed that as a result of education, there was a 14.4-fold greater likelihood that they would react to the information available in the guidelines. Put in other words, there was a less than 1% chance that if they did not use a measure, it was from lack of understanding of the guidelines. In terms of real numbers, what used to be about a 50% chance of getting assessed in phase 1 went up to over 80% in phase 3.
Physicians in the long-term care facilities decided for themselves whether to use antithrombotic drugs or other measures to prevent venous thromboembolism.
Where there were caregiver issues of quality of life, which we are very clear occurred in the nursing home, patients essentially had the same illness in phase 1 and phase 3. They found ways around by using non-drug therapies, such as stockings, compression devices, or encouraging motility or mobility, which would have also gone a long way to preventing measures. So the physician thinking essentially changed.
But it sounds like simply from the education of using those practice guidelines, many more patients were assessed for venous thromboembolism.
That is correct. The power of education, I believe, is huge. And the big question is how to sustain that effort into the months and years to come, and how to reorganize this at a scale that is national.
Reporting for Global Medical News Network, this is Sherry Boschert.